And you have been sending plenty of questions about the planned 4-week lockdown across England. And to answer them, we're joined by Dr. Bharat Pankania, expert in communicable disease control and outbreak at the University of Exeter Medical School, and Dr. Linda Bauld, who's Professor of Public Health at the University of Edinburgh. Both on the programme many times before. Thank you both once again for joining us. I'll go straight into the questions. The first one from Holly Stoddart. Dr. Pankania, should those who live with someone who is extremely clinically vulnerable avoid going to a high-risk job?
Yes, this is very important because they could go to a high-risk job and bring home the infection to the vulnerable person at their home. So my advice has been, please negotiate with your employers and explain to them what the situation is at home, and try and get yourself to work from home or be redeployed, because you don't want to bring home the infection to your loved one back at home.
Dr. Linda Bauld, you agree? I can see you nodding your head.
Yes, absolutely. I think it's really important. I mean, I would emphasise, I think there may be more questions on shielding because people are confused. The government is due to issue more specific guidance on extremely clinically vulnerable people. Today, it's not out yet. I've just had a look. And GPs and government should be writing to people in that category. So I would really be cognizant of tailored advice for those individuals and their families as well.
Well, let's have some tailored advice, because John Shepton asks exactly about that. Why are the shielded, he says, not being shielded again?
So there's two main reasons for that. The first one is that the categorization of people who were shielding last time was not as tailored as it should have been in terms of people who are most at risk. And we know much more about the categories of people at risk from COVID-19. So that's the first point. The second one is around mental health. If you remember, Simon, initially it was around 12 weeks that shielding applied for, and then of course it was extended depending on where you lived within the UK. That was a really long period for people to be living under those circumstances. But the guidance that's been issued for England now is very clear that people who were previously in the shielding category must take additional care to protect themselves, absolutely sticking to the guidance, only going out and when necessary, of course, to exercise or go outdoors, and then following the hand and respiratory hygiene that we're all so familiar with now. So not a return to shielding, but still a lot of caution for those groups.
And Dr. Pankania, one more on this, because David Evans says, what is the advice for former shielding people who cannot work from home? Are they not to go to work?
Well, no, they have to look at what their categories are. And if they are in a vulnerable position, in other words, they have a severe illness like immune suppression or other illnesses which will be listed, then they mustn't go to work. But having said this, listening to my fellow colleague from Edinburgh, I would also say I don't want people to become prisoners. So as long as they can wear their mask properly and undertake infection control, they should go out and about and take long walks, because going out for walks in the country isn't going to make you get an infection.
Right. Now, Dr. Bauld, this one from Karen Reynolds. I have a dentist appointment in November. Can dentists stay open? And we should say we're talking about November the 5th, the Thursday. Anything up until then is as it is now.
Yes, good news for Karen. So the government has been very clear that they need to keep the NHS up and running and essential services up and running. And people are able to leave their homes to attend those appointments, and that includes for dentistry. And in fact, the British Dental Association has been commenting on the developments recently and emphasising to people that dentists, of course, as we know, are now open again. It is not business as usual. There's a huge backlog of cases. But if Karen has an appointment, there's no reason why she can't attend that.
Right, that's clear. Dr. Pankania, Gillian Greenhead says, if one member of a household has been in contact with a person confirmed to have COVID-19, why don't all the members of that household have to self-isolate?
Well, my answer for Gillian is quite simple. Gillian is a contact of a case. Her family members are contacts of a contact. So contacts of a contact don't need to isolate. However, if Gillian, on the other hand, were to become a case, then her family members become her direct contacts, in which case they would have to isolate.
A lot of people will be a bit confused by that. I count myself in that group, because what she's clearly implying, Gillian, is that if you're in a household and one of you is vulnerable, you all are. It's one for all.
Yes, the trouble is Gillian is the one who has been exposed to the virus. So if she's going to become a case, it will be her. And I totally agree that by the time she has become a case, her family members will also be contacts of that case, i.e. contacts of Gillian. But if we were to exclude Gillian and her family members, that would be an excessive exclusion and also unnecessary. So you only focus on direct contacts to be removed from circulation in the first instance.
Dr. Bauld, there is a lot of confusion about this, isn't there?
There is, and there's also additional advice, though. I mean, let's imagine, Simon, households are not all the same. And my colleague from Exeter has just made an excellent point that in many cases, the contact who's coming to contact with somebody who's tested positive may not actually develop the virus themselves. And if you were then to say in a house of students, for example, with 12 people living in a flat or young people working in different jobs, that they all had to be isolated, that would be excessive. So it is about trying to recognize that there are things you can do within the household to reduce the risk. So just very briefly, if Gillian has been told that she's a contact with somebody who's tested positive, she can try and protect her other household members by using a separate bathroom, making sure that she's in the kitchen at a different time, sleeping in a separate room, cleaning the bathroom after she's used it, etc. Those are all practical things that she can do.
Okay.
Yes.
Right, Bharat, if I may, you've been on the programme many times. I'm going to call you Bharat from now on. This is from Christine Martin, who says both my daughter and son-in-law work for the NHS. They've got 2 children aged 8 and 4. As grandparents, can we have the children to stay to give their mum and dad some respite?
Well, they would come under the category of essential care givers, and childcare is one of those essential items that they have to do. And therefore, of course, they can do it. But my supplementary advice is, look, you're going from one household to another. Make sure you keep your circulation amongst other human beings low, because you don't want to be introducing infections to other households.
Right, that's clear. This from John Joy. Dr. Bauld, can my husband and I travel 40 miles within our own local authority to collect our 3-year-old granddaughter and take her to a park?
Well, the brief answer is yes. So there are a couple of caveats there. The first one is people in England are being encouraged not to travel outside of their local area if they can avoid it. But if that sounds like it's within the same local authority area, and I think if you can do that within a few hours, that's acceptable. That's the first point. The second point is, crucially, the term outdoors. So people are allowed to meet up with one other person outdoors, but children don't count in that one person. So, for example, those grandparents together could go and meet that granddaughter outdoors, and places like public parks are exactly the type of place that we should be accessing at the moment. So traveling short distances, meeting up with somebody, including a child or children outdoors, is definitely something that's still permitted.
Right, that was from Joyce Hawthorne. Now, this one is from John Joy, who says, how do masks stop the virus? Dr. Pancankram.
Well, the masks cannot prevent you from getting an infection 100% of the times. So the idea of wearing the masks is to reduce the shower, or the number of droplets that may be coming to you as a direct hit. So that's one way. The second way is also that if you are in an environment, an indoor environment where there is aerosol spread, then that mask again reduces the number of infectious particles that may be coming towards you. And then finally, if you are the infectious person and you breathe out into your mask, then you are also reducing the number of virus particles that are coming from yourself. So all those measures, simple idea of wearing the mask, protects you and protects others.
Right. Dr. Bauld, this one from Anna Milne. Should people who can't wear a mask be able to go out due to the risk of transmission?
So there are some categories of individuals who are not able to wear face coverings for very good clinical reasons. So we know that, and we have to support those people as well. Should they go out? Outside, absolutely. There are very minimal risks to moving around outdoors, as we've heard from Bharat before. Exercise is so important. And what I would say in terms of them going into indoor settings, for example, to access essential appointments or retail, it's really important that the other people around them are wearing face coverings. So if they're concerned about any environment, they should avoid it. But other people wearing face coverings, as Bharat's just described, provides protection to that person who's not able to wear one because of clinical reasons.
Great. We've got one last question. I'll put it to both of you. First of all, Dr. Pankanya, I have a cleaner who comes to my home once a week. Can I still let her come? That's from Lisbon.
Well, yes, provided you're not interacting with your cleaner. Now, you must remember that your cleaner will be going to many other households as well. Therefore, you really need to be careful. And your risk assessment is, can my cleaner come, do her business, and leave without interacting with me in a safe way? Yes, go ahead.
Linda, is that right? Because a lot of people will say, hang on, that's non-essential travel, surely.
Well, actually, it's a little bit unclear. I'm sure Barrett and I are doing exactly the same thing, which is trying to catch up with very specific advice that government's not fully worked through yet. Let's bearing in mind that the guidance for England only came out recently. So it's absolutely the case that essential workers, as in if your roof is falling in or you need repairs, can go into your home. It's actually not so clear at the moment whether domestic support that's not childcare or healthcare or social care can continue. What I would say is, take on board the advice you just heard, very sensible. But I would ask, if we're only having a few weeks of this period, there are risks associated with anybody coming into your house. Does that really need to continue? But again,
yes,
we are going to see more detailed guidance from government for lots of these questions, which the public, of course, are quite rightly asking at this time.
And thankfully, you're both there to answer them. Dr. Barrett Pankania, Dr. Linda Bauld, thank you so much. Good to see you again.
Thank you.